In July of 2020, Illinois became the first state in the country to create a health benefits plan for undocumented immigrants. This plan, titled Health Benefits for Immigrant Seniors, is a Medicaid-like product that covers immigrants within their first 5 years of residency who are age 65 and above and facing poverty. The following year, a nearly identical plan went into effect, the main difference being that the plan was for adults age 55 to 64. 1 year later, in 2022, the state of Illinois continued the expansion of health benefits for immigrant adults and altered the eligibility requirements to cover immigrants age 42 and above. These developments are a huge win, not only for immigrant rights in the state of Illinois, but for human rights everywhere, as this state-sponsored coverage serves as a strong affirmation of the fact that healthcare is a human right, something we've believed at Community Health for 30 years. Welcome everyone, my name is Alice Wu. I'm the Foundation Relations Manager here at Community Health, and I'm joined today by CEO Steph Willding. Steph, thank you for being here. We're going to talk today about some recent developments in state-sponsored insurance expansion here in Illinois.
Thanks for having me, Alice. It's great to chat with you today.
So the state has been expanding gradually over the past few years. How has that impacted Community Health's patients?
Yeah, so we've had a couple of phases throughout this. As I mentioned, the state has been each year expanding health benefits to immigrants, and the first iteration of this was HBIS, so health benefits for seniors. At the time, this was certainly something we celebrated and welcomed, and we worked with our patients to enroll them in HBIS and to work with them to be coordinated into a new medical home. And the reason we did this is because that was consistent with what we've always done. And it was about 6 months into that we began to have our patients who enrolled in HBIS come back to us. And something that we really pride ourselves on at Community Health is how we listen to our patients, whether that's our patient advisory group, focus groups in the community, our patient engagement surveys. We really do listen to our patients and try to build plans and decisions around that feedback. And we were hearing a lot from our patients. And it was largely around the challenges that they experienced once they left Community Health's ecosystem. And those challenges ranged from difficulty gaining access to primary care services.
But they already have insurance.
Individuals may now have access to health insurance, but that's really just the first step. The second step is ensuring access to care. For example, how many providers in a patient's geography accept that form of insurance? Or perhaps that provider doesn't speak the patient's language. It's also possible that that provider may not be accepting new patients, which I would say is what we heard most often from our patients was that they found a new provider or a new medical home, but it was a 3 to 6 month wait to see someone.
For an initial appointment.
Wow. Another challenge that our patients returned to share with us, and one that we were not surprised to hear, was that patients lost their access to specialty care services once they left Community Health. This is an area we're unique and we truly excel. We don't just see primary care as being part of essential health care. We see specialty care like endocrinology, nephrology, podiatry, neurology, all services that we provide directly as part of being essential to maintaining someone's overall health and wellness. Our patients can receive over 25 different specialty care services here at Community Health. And when they went elsewhere, they found that they lost that access. And so it was really through our patients returning and giving us this feedback that we realized that by coordinating patients out of care with Community Health, out of our medical home, they were losing access to essential care. So we were essentially not living up to our mission.
And what is that mission?
Yeah, the mission of Community Health is to serve people without essential health care.
Once Community Health learned about this from our patients, what were our next steps and what are our next steps now as the insurance expansion continues?
Through the leadership of our incredible board of directors, Community Health has decided that those we serve, the people we serve, will include uninsured, as it always has, but it will also include patients that have health benefit coverage through HBIS and HBIA. One of the reasons for this, as we mentioned, is because we want to ensure that folks who have been in our medical home have the option to remain in our medical home with access to all of the essential services they've always had. The other piece of this is, and this gets into the real technical aspect of it, but it's important from a business model perspective, that HBIS and HBIA function like a Medicaid product, but they're not actually federal Medicaid. They are state-run and a state-funded health benefit program, which means that it does lend itself to the vulnerability of a financial crisis. You know, when there's change in leadership, there could be shifts in enrollment caps, in what could be covered, et cetera. And so at Community Health, we want to make sure that we remain that constant for our target population, for our community, regardless of how HBIS, HBIA programming may change over time. Because when we're talking about essential healthcare access, right, if that's our mission, then seeing patients with HBIA, HBIS still makes sense.
So community health is serving the same population, but under different insurance coverage situations.
Mm-hmm.
So how does that affect our model of care and, in fact, our business model? Are we going to be seeking reimbursement for individuals who have coverage?
Yeah, that's a great question. From a model of care perspective, for the most part, things remain the same. There'll be a few tweaks to individuals who have HBIS or HBIA. For example, they will receive their prescription medications, which are fully covered under those plans at private pharmacies versus the pharmacy at Community Health. From a business model perspective, our business model of 3 pillars of volunteerism, philanthropy, and partnership will remain intact, and we will not be seeking reimbursement or be billing for patients we serve under HBIS, HBIA. When looking into the finances of it, you know, an average reimbursement for a new patient visit for primary care is going to be between $24 and $74. And when you hear those numbers, you understand why many medical providers choose not to accept this form of insurance, because from a financial viability perspective, you're leaving money on the table, but you're not leaving enough money on the table to justify the reimbursement process. You know, for Community Health, though, this goes well beyond financial viability. This expansion of health benefits for immigrants really gave us as an organization and the board an opportunity to look inward and say, what are the reasons why we're able to provide such high quality healthcare? What makes us different? What makes us unique? The ingredient that is the most essential to our success is that when a patient walks into Community Health, we do not see them as a form of revenue. We see them as an opportunity to live our mission and to provide really robust access to high quality care. And so at Community Health, we have decided to lean into that difference, lean into the way that we disrupt how the rest of the healthcare ecosystem works, where the patient is seen as a source of revenue. By remaining a free health center, we're able to maintain over 25 different specialty care services. It means that our patients are able to access primary care that focuses heavily on prevention. And they have 45-minute appointments with their provider. They have access to clinical nursing education, pharmacy education. All of that leads to higher quality outcomes for our patients. Our patients at Community Health are healthier because of all of these things, and we can maintain that model of care by staying a free health center.
Is this a permanent change for Community Health? Will we now forever be a clinic that serves uninsured and underinsured people?
This is what we are doing right now. And we are going to continue to monitor the situation of how future expansions occur, or even potentially future contractions. For 30 years at Community Health, our priority has been our patients and our community. And that doesn't change. And in fact, providing care in this new environment and doubling down and grounding ourselves in what makes us unique and what makes us different and not shying away from that. I'm so excited for what we're going to do next and how we're going to be able to continue to serve our patients in our communities like we always have, with free high quality, comprehensive healthcare services.